Stop. If you've been told your back pain is just about your spine, you've been lied to. Every single day, 65 million Americans wake up in agony, and here's the terrifying part. Most of them are treating it completely wrong. I'm Dr. Martinez, and what I'm about to reveal will fundamentally change how you understand your back pain. Here's something that will blow your mind. Studies show that 64% of people with zero back pain have herniated discs on their MRI. Let me say that again. No pain, but their scans look terrible. So if your disc isn't the problem, what is? And those stretches your physical therapist gave you. For 40% of people, they're actually making things worse. But before I explain why, let me ask you something. How long have you been dealing with this? 6 months? 2 years? 10 years? There's a scientific reason why your back pain keeps coming back, and it has nothing to do with your discs, your alignment, or your posture. Let me tell you about Sarah. 42 years old, mother of 3. She came into my office after 5 years of chronic back pain. She'd seen 7 different specialists, had 2 MRIs, tried cortisone injections, physical therapy, chiropractors, and pain medications. Nothing worked. She'd spent over $47,000 trying to fix her back. And you know what every single doctor told her? They said it was psychological, that she needed to manage her stress better. Can you imagine? 5 years of real, debilitating pain, and they told her it was all in her head. But here's what none of those doctors understood, and this is where everything changes. Your back pain isn't coming from where you think it is. See, everyone focuses on the spine, the discs, the bones, the alignment. But 85% of chronic back pain has nothing to do with structural damage. Here's what's actually happening. Your brain creates protective tension patterns in your muscles. It's like a security system that never turns off. And this tension, this constant, low-level muscle contraction, is what's causing your pain. Let me explain the science, and I promise I'll make this simple. Your brain has one job: keep you safe. When you experience stress, trauma, or even just sit in a bad position for months at your desk job, your brain sends signals to your muscles saying, tighten up. Protect the spine. Now imagine this. You sit hunched over for 8 hours a day. That's 2,080 hours per year that your brain is sending protection signals to your back muscles. Day after day, week after week, year after year. Eventually, those muscles don't know how to relax anymore. They're stuck in a protection pattern. And that's your back pain. Not a herniated disc. Not a pinched nerve. Chronic muscle tension. Now, if you're listening to this and thinking, oh my God, that's me, I want you to know something really important. This is not your fault. You're not broken. You're not imagining it. Your pain is 100% real. The problem is that we've been treating back pain all wrong for decades. We've been chasing structural problems on X-rays and MRIs when we should have been addressing the neurological patterns causing muscle tension. And here's the part that makes me angry as a physician. The medical system has failed you. Because there's no money in teaching people how to retrain their nervous system. There's no profit in telling you that you can heal yourself without surgery, without drugs, without endless appointments. But that's exactly what I'm going to teach you today. Let's break down the 3 main causes of your back pain, and I'm going to give you specific solutions for each one. First, the psoas muscle. This is a deep hip flexor that connects your spine to your legs. When you sit all day, this muscle gets short and tight, and because it attaches directly to your lumbar spine, it pulls on your lower back, creating pain. Every hour you sit, your psoas gets tighter. And here's the kicker, traditional stretching doesn't fix this. You need to do something called constructive rest position, and I'll show you exactly how in a moment. Second, the brain-body disconnect. Remember Sarah? Her brain had learned to associate movement with danger. Every time she bent over, her brain screamed danger and flooded her muscles with tension. This creates a vicious cycle. Pain leads to fear. Fear leads to tension. Tension leads to more pain. Breaking this cycle requires retraining your nervous system, not just strengthening your core. Third, fascial restrictions. Fascia is the connective tissue that wraps around every muscle, organ, and bone in your body. Think of it like a full-body wetsuit under your skin. When you have inflammation, injury, or chronic stress, your fascia gets sticky and tight. It loses its ability to glide smoothly, and because it's all connected, tightness in your hip can create pain in your lower back, even though the hip is the real problem. This is why people get temporary relief from massage or adjustments, but the pain always comes back. You're treating the symptom, not the root cause, so now you understand what's causing your pain. Now let me give you the framework for actually fixing it. First, you need to tell your brain, hey, we're safe. You can turn off the protection patterns. The fastest way to do this is breathing exercises combined with gentle, supported positions. Spend 5 minutes a day lying on your back, knees bent, feet flat, breathing deeply into your belly. This activates your parasympathetic nervous system, your body's rest and digest mode, and signals to your brain that it's safe to let go of tension. Second, release that psoas muscle. Here's a simple technique. Lie on your back with your knees bent. Let one knee fall gently to the side. Hold for 30 seconds, then bring it back. Repeat on the other side. The key: move slowly. Let your nervous system feel safe. If you force it, your brain will just create more tension to protect you. Third, you need to address fascial restrictions. Use a foam roller or massage ball on your hips, glutes, and thighs, not directly on your painful lower back. Remember, the pain location is rarely the problem location. If your lower back hurts, the restriction might be in your hip. Spend 2 minutes per area, breathing deeply, allowing the tissue to soften. Remember Sarah. After 5 years of suffering, she tried this approach. Not because she believed it would work. She'd given up hope by then. But because she had nothing left to lose. In the first week, she noticed small changes. She could bend over to pick up her kids' toys without bracing herself. She could sit through dinner without shifting positions every 5 minutes. By week 4, the morning pain that had defined her life for half a decade was gone. And by week 12, Sarah sent me a video of herself hiking with her family. She was crying tears of joy because she'd forgotten what it felt like to live without pain. She told me, "You gave me my life back." But here's the truth. I didn't give her anything. I just showed her what her body was already capable of. I helped her understand that her brain had been protecting her, and she had the power to tell her brain, "It's okay. We're safe now, so here's what I need you to understand, and this is the most important thing I'll say. Your body is not broken. Your pain is not permanent. And you are not destined to live like this forever. What you're experiencing is your body's incredible, almost miraculous ability to protect you. The problem is that the protection system got stuck in the on position. But just like it learned to create pain, it can learn to let it go. This is neuroplasticity, your brain's ability to change, adapt, and heal. And you have access to it right now. Today. In this moment. Try the 3 techniques I showed you: breathing, psoas release, and fascial mobilization for just 5 minutes today. That's it. 5 minutes. Commit to 30 days. I promise you, if you do this consistently for 30 days, you will notice a difference. Your pain has a message. It's been trying to tell you something. Maybe it's saying slow down, rest, move differently, release stress. Whatever the message is, it's time to listen. You deserve to live without pain. And now you know how.